Thank you so much for watching Mid-Level U today. Today we have a very special guest, Alex Fisher. She's an associate at Thompson Burton here in Nashville, Tennessee, graduate of Vanderbilt University School of Law. She's a great attorney. She works a lot with nurse practitioners. She's here today to kind of explain to us some of the issues that she commonly sees, most importantly, prescribing controlled substances. So Alex, what do you commonly see nurse practitioners run into when it comes to prescribing controlled substances?
One of the main things I run into is appropriate documentation. So documenting the rationale and the justification for prescribing something, particularly narcotics. Another thing I see is signing your name to a prescription when you might not have been the one who saw the patient. So it might have been your supervising physician or another nurse practitioner who saw that patient, but you write your name on the prescription.
Got it. Who's usually reporting these violations to the Department of Health? Is it the nurse practitioner themselves, the supervising physician? How are NPs getting in trouble when it comes to prescribing?
So while you can report yourself, I don't recommend that. So in Tennessee at least, and in most states, it's a complaint-driven process. And what that means is anyone in the public can file a complaint with the Department of Health. So we see everything from supervising physician to the owner of a clinic to a fellow nurse practitioner or nurse to a patient or a family member of a patient who may file a complaint on you.
Got it. Can you give a couple of examples of cases that you've seen in your practice where NPs got in trouble with prescribing controlled substances, and particularly people who may not have thought they would have come under scrutiny when it comes to this practice?
Yeah, that's a great question. So first, I love working with nurse practitioners because they're generally very kind and very caring and very devoted to their patients. And it's kind of that sensibility that can sometimes get them in trouble with prescribing. So for example, I've seen clients who prescribe to friends and family, and even though there's no regulation against prescribing to just generally friends or extended family, you have to have documentation of that, the same way you would as if they were any sort of patient who was on the schedule and walked into your office that day. Another thing I see is prescribing outside of the notice and formulary. So being aware, especially in a state like Tennessee, where you have a specific notice and formulary and a supervising physician, and being aware of what you're allowed to do and what you need to check with your supervising physician to see if you have permission to do.
Okay. So about the documentation, this is a question that I run into a lot from nurse practitioners. What specifically do you need to document? For example, when I see a patient in the emergency department, is it enough to check the box 9 out of 10 back pain and tenderness on exam, or do I really need to kind of type out a full paragraph as to why this person needs a narcotic or another kind of controlled substance? How specific does your documentation need to be?
So that's a great question. And in Tennessee, the Board of Nursing regulations, specifically for nurse practitioners, actually lay out what sort of things they're looking at if they're concerned about your prescribing. So I really advise your viewers to go to your state's regulations as a resource, and they'll set forth what their guidelines would be if you were in trouble. But things that I typically see and that I typically recommend are if you're prescribing narcotics for a long period of time, you're going to need a lot more justification. So trying to diagnose where the pain's coming from, different sorts of testing, maybe some sort of pain contract with the person if they're on a narcotic for a long period of time, urine drug screening, versus in a situation like you're in where you're dealing with more acute care. It's really left to your discretion. You don't have to have quite as much documentation because you're not justifying narcotics over a long period of time. But if someone comes in and just complains of back pain and you can't see anything on physical exam, you might want to add in extra documentation that you talk to them about non-narcotics, you talk to them about going to a chiropractor, that you pursued other avenues and at least discuss those before just prescribing a narcotic to someone.
Okay, great. That's good advice. Talk to me a little bit about the controlled substance database. I understand that this is really important, especially in prescribing controlled substances for patients over long periods of time, or if you work in a pain management clinic. How important is it to check that database, and can you give any parameters or advice for doing so?
That's a great question. So hopefully if you have electronic medical records, there should already be in your system a radio dial button where you can click for each patient to show that you checked the controlled substance monitoring data bank on that patient. So if you're prescribing over any extended period of time controlled substances, so that's including Adderall, that's something that I'm seeing a lot of providers get into trouble with. You need to make sure that that patient is not getting the same prescription for multiple providers. And so that just provides protection to you, that you're checking to make sure that your patients aren't doctor shopping. And if you're in a place like parts of Tennessee that are really close to Kentucky or parts of Tennessee that are close to Mississippi, you might even want to check with another state to see if you can access their controlled substance monitoring data bank and gain access to it as well.
That's really good to know. And I think one thing I see a lot of nurse practitioners do in the emergency department, for example, is they check that database, but maybe they forget to write down that they actually ran this patient through the database. And so I think that's great advice to ask your administrator or somehow note in your chart that you've checked the controlled substance database, because it sounds like it can really help keep you out of trouble.
And something that a lot of my clients or people I talk to will say is, I'm a healthcare provider. I just want to take care of patients. Documentation, I'm sure, is the most boring part of your day.
Yes.
But it's important to look at it as insurance for you, and it protects your license so that you can continue to help and provide good care to people for many years in the future.
That's a great point. I think, a lot of times at work, I'll sit there and I just feel like I'm filling out chart after chart, but it can lose, the weight that it carries. And so I think that's great advice to really watch your documentation, especially when it comes to prescribing controlled substances. So thank you so much for all the help you've given us today. Alex, again, practices in Nashville. She works at Thompson Burton. She's available to answer any questions you might have when it comes to prescribing controlled substances. She helps out a lot of nurse practitioners. So feel free to send her an email, ask questions, reach out to her if you have any sort of needs.
Thanks, Erin.
Thank you.